Nick, let's go to The Age, the crosstown rival, and they've got an exclusive tomorrow with the headline State's bid for the health reform. It's basically saying that the Premiers of Victoria and New South Wales will try to convince the federal government to increase funding to GPs and boost the Commonwealth share of hospital costs, because hospitals are struggling as unprecedented numbers of people present to emergency departments. Do you think this will also now be a perfect storm of a discussion with premiers and treasurers around the country, and state ministers, I should say, around the country about carving up the GST to fund our hospitals? And how do you think that that's going to play out for the new federal government?
I think it's a very, very difficult issue, and I think we've seen, the previous federal government struggle with this, and we've seen the state government in South Australia, for the Liberal state government, fall on this issue, but largely on the issue of hospitals and ambulance ramping. I think this is the big issue at the moment. It's an issue that Dan Andrews is going to struggle with in the state election later this year. But I kick back against this idea. It's the answer is more funding and more federal funding. I think we want to see the money spent efficiently. I've always thought that if you put, say, the head of Amazon in charge of the ambulance service in Victoria, he'd probably be able to fix it in a week and save money. I think that we have to address this efficiency of government services rather than every time there's an issue just throw money at it, which seems to be what is happening right now.